Hey everyone, welcome back to my channel. Today we're tackling a topic that millions of people experience but may not know how to handle effectively. Getting rid of E. coli in the urinary tract. If you find today's video helpful, make sure to subscribe, share, and leave a comment below. Let's dive in. But first, what are the things you'll need to complete this task? For the full list and where to get them, check the description and pinned comment below. Now that you have all your tools and materials ready, let's get into it. Get rid of it! Step 1. Consult a doctor. The first thing you should do if you suspect you have a UTI caused by E. coli is consult a doctor. They will usually ask for a urine sample to confirm the diagnosis and determine which antibiotics will be most effective. The American Urological Association has a great set of guidelines on diagnosing and treating UTIs, updated in 2020, if you want to read more. Step 2. Complete the antibiotic course. Your doctor will prescribe antibiotics, and it's critical to complete the entire course, even if you start feeling better. According to the Centers for Disease Control and Prevention, incomplete antibiotic treatments can lead to antibiotic resistance. Step 3. Stay hydrated. Drinking plenty of water helps to flush out the bacteria from your urinary system. The Mayo Clinic advises this as a standard practice in treating UTIs. Step 4. Consider natural remedies, but consult your doctor. Some people swear by cranberry juice as a natural remedy to help prevent UTIs. A 2012 study published in Archives of Internal Medicine showed some promise, but concluded that it shouldn't replace medical treatment. Step 5. Introduce good bacteria. After antibiotics, it might be helpful to consume unsweetened probiotic yogurt to restore good bacteria in your system. Johns Hopkins Medicine has endorsed the benefits of probiotics, especially after antibiotic use. Step 6. Use a heating pad. A heating pad on a low setting can help relieve pain, but this doesn't treat the underlying infection. Always follow your healthcare provider's advice on symptom relief. Step 7. Monitor symptoms and follow up. If symptoms persist after completing your treatment, consult your healthcare provider for a follow-up. It might require more rigorous treatments or tests. Step 8. Take preventative measures. Once you've cleared the infection, take preventative measures like wiping front to back, urinating after sexual activity, and staying hydrated to prevent future UTIs. Alright, that wraps it up for today's video on how to get rid of E. coli in your urinary tract. If you found this video useful, make sure to subscribe, share, and leave a comment below.